Hello, I am Dr. Chandrashekara S., rheumatologist at Chennai Rheumatology Immunology Center, Bangalore. Most of the time, a patient with arthritis comes, we do a test called rheumatoid factor. Rheumatoid factor is a test which is done when we are looking forward for the diagnosis of rheumatoid arthritis. We need to remember rheumatoid factor positivity doesn't mean rheumatoid arthritis. It can also be present in various other conditions. Patient who have joint pain as well as rheumatoid factor, if it matches, then only we can consider the diagnosis of rheumatoid arthritis. Anti-CCP is another test performed while assessing and diagnosing rheumatoid arthritis. Anti-CCP is a specific test. This test, when it is present along with the joint pain, one can reasonably make a diagnosis of rheumatoid arthritis because anti-CCP is not commonly seen in other conditions. Anti-nuclear antibody is another test which is often performed in a patient who suffer from joint pain, skin lesion, hair loss, fever, oral ulcer, and many other symptoms when they are present. But we need to remember, when these symptoms are present and when ANA is positive, especially when it is done by immunofluorescence test, can be considered to have a diagnosis of SLE. But we need to remember, ANA can be positive even in 5% of individuals who doesn't have any disease, even in normal individuals. Hence, presence of ANA doesn't mean SLE. ANA can also be present in many other connective tissue diseases. We use two other tests called ESR and CRP. Usually, ESR and CRP suggest the possibility of inflammation. ESR and CRP can rise for any inflammation, not necessarily for arthritis. Infection like TB, chronic infections, any infections, ESR and CRP can rise. In the absence of any infection, in patients with arthritis or any connective tissue disease, ESR and CRP serves as a marker to estimate or to make us to understand how much the disease is active. What it means is, presence of or elevated ESR and CRP can be used as a marker to assess how much or how good the arthritis or the disease which we are treating is under control. HLA-B27 is another test which we perform when we are evaluating the patient suffering from joint pain. Especially if they have low back pain, stiffness, or any other joint pain, we do this test. This test represents a gene by name HLA-B27. We need to remember, all people with HLA-B27 do not develop this disease. Out of 100 people who have HLA-B27 positive, only 10 may suffer or develop this disease. So that's why it is not recommended for everyone to do this test. Unless you have these pain, symptoms or anything, that's the only point when we should do this test called HLA-B27. Uric acid is a test which is often done when evaluating arthritis. Uric acid can be elevated in many conditions, including several metabolic diseases. If you eat excess of non-vegetarian food or any food which increases purine load, can also increase uric acid. Sometimes arthritises like psoriatic arthritis and few other arthritises, uric acid could be increased. Increase in uric acid doesn't mean gout, but if one has a symptom matchable to gout and also have higher uric acid, then we can consider a possibility of gout. There is no single test which can decide that the person or an individual has a specific arthritis. The test can be positive sometimes even in a normal circumstances or even in other condition. The best example is rheumatoid factor, which can be positive in 5% of normal individuals. They may not develop their rheumatoid arthritis or any disease in the rest of the lifetime. Hence, a test of positivity in a person otherwise who doesn't have arthritis doesn't imply him to have arthritis. Person should have symptoms and we should match to symptom the investigation test and its report, then only we can make the diagnosis of an arthritis.